Aam Aadmi Party's flagship healthcare initiative, the Mohalla clinics, as we all know of, is now facing allegations, and serious ones, of financial irregularities and inflated testing figures. Based on preliminary inquiry by the anti-corruption branch, two private diagnostic labs contracted by the Delhi government are under scrutiny for their alleged involvement in a scheme that involves ghost patients and fake tests. Fake lab tests, financial loss, inflated costs, and phantom patients. The list of discrepancies only gets longer. Now, what is being said in this report? Over 65,000 tests conducted by the Agilus Diagnostic and Metropolis Healthcare that are suspected to be fabricated, involving ghost patients who never actually visited the clinics, don't even exist. The alleged fake test results of a potential loss of over 72 lakhs to the public exchequer. Now, the Delhi government paid apparently 4.63 crore for these tests, with individual costs ranging from ₹100 to 300 rupees. And the investigation has revealed that nearly 63% of these patients associated with suspicious tests. We also talk about the ACB report that has confirmed these allegations. Let's talk about as far as what those allegations are. The Agilus Diagnostics Limited, Feb 2023 to November 2023, over 12,450 tests that were done on blank mobile number. Blank mobile number, that is being said in those Mohalla clinics of the AAP Sarkar. 25,732 tests that were conducted on mobile number with number 0. Imagine a mobile number with just 0, no digits. 913 tests that were done on mobile numbers starting from 1, 2, 3, 4, 5. If you ever heard of a mobile number starting from 1, 2, 3, 4, 5. Another allegations that is being raised, the 2,467 tests that were done on mobile numbers and repeated 80 times plus at least. Let me straight away go across to Priyank, and we also have Bhavtosh joining us with more on that. Because Bhavtosh, good morning to you as well. Sabyasachi is also with us right now. Bhavtosh, if you can help us understand these discrepancies and the possible financial loss to the public exchequer, or what these fake labs and these fake tests may have cost.
Amita, as far as this probe is concerned, the preliminary probe was handed over to the ACB. And remember, this is a physical verification report that has been carried out by the ACB. And this is not in FIR, so it required a lot of effort on the part of ACB to carry out its own preliminary probe. And they physically verified all the numbers that were registered with these two private labs. Having said that, these two private labs were given the task of registering the mobile phone number and then carrying out the test as well as the treatment of much touted Aam Aadmi Party's Mohalla clinic. Now, when they started calling up these numbers, which are subscriber dialed record numbers, they found that these numbers actually were not even registered. Now, some numbers, as you rightly said, were 0. Some numbers were random numbers like 1, 2, 3, 4, 5. Some numbers were 7, 4, 5, 6. So that numbers were immediately discarded. But some numbers which were registered, which were actual numbers, those individuals said that they never in fact received treatments. Some numbers were numbers which were registered, but they were numbers that were registered on different patients. Now, in one particular number, that was actually a correct number, but at least 711 patients had received treatment between February to March 2023. ACB, on its part sources within ACB, has said that, look, we have carried out these preliminary preliminary investigation, but this required a lot of effort on our part. And these inquiry reports that we have submitted are only for a period of February to March 2023. Remember, this AAP Mohalla clinic, the much touted AAP Mohalla clinic, has been in existence for nearly 10 years. If they have in fact found these discrepancies and this alleged scam for just in 10 months period, one can imagine the kind of scam we are talking about here. And what ACB officials have further said that the cost of each test varied between 100 to 300 rupees. They have already detected that of 24 lakh tests that were carried out, 65,000 tests were completely fake because the numbers did not exist. In some cases, the number existed, but several thousands of people had carried out tests on that particular number. So those tests would also be, in fact, those numbers would again be re-verified, again be checked.
Bhavtosh, please to stay on with us. Sabyasachi is also with us. Sabyasachi, we would want to reiterate the Times now has the exclusive copy of the ACB report. This is the ACB preliminary inquiry report that has also talked about these allegations that have been levelled. How much are the estimates that we are looking at the loss to the public exchequer?
Well, absolutely. See, we are looking in crores a loss to the exchequer, and clearly at this particular point, the Mohalla clinic, which was the flagship movement from the Aam Aadmi Party, is under the scanner of the ACB. And the report which Times now has exclusively accessed clearly shows the scam that has been carried out. And clearly in these details, it could be seen that doctors were not present at the Mohalla clinic. If we talk about around 7 Mohalla clinic were under the scanner. In these Mohalla clinic, doctors were not present and they were marking their attendance with pre-recorded videos, and the medicines was provided to the people of the national capital with unauthorized staff. And if you talk about the fake lab test, like Bhavtosh was telling us, that random numbers were registered, 999, 000, 1235. These fake numbers were registered and even test was carried out. And by doing the test, even these 2 private companies have asked the money from the Delhi government, and Delhi government even paid these money to these 2 service provider. So clearly at this particular point, the ACB is investigating this matter, and as we know that earlier the health department also had initiated an inquiry into this matter. If you talk about the substandard medicine that has been provided at the Mohalla clinic as well as the Delhi hospitals, and also the fake lab test incident that has come into light.
Let me go across to Shehzad Poonawalla as well, joining us here on the broadcast. Shehzad, good morning. This is explosive. This is the healthcare initiative, the Mohalla clinics of the AAP Sarkar, and there have been damning allegations that have been levelled in this preliminary inquiry being conducted by the ACB.
Look, from दारू to दवा, ऐसा कोई विभाग नहीं जिसको केजरीवाल and company ने ठगा नहीं. Amita, we know that this case is a blatant case of how even fuzzy tests were done. You know, patient mobile numbers with just 0-digit entered, there were around 12,000 numbers like that. 8,000 numbers were found blank. Thousands of numbers were non-existent. That means these tests were never done. And if you see the rate at which the tests are being done, it is impossible because that kind of crowd was never there in Mohalla clinic. This means that this was only the money that was being made in the name of tests. So imagine how the common man of Delhi has been given a kind of a thuggery that Aam Aadmi पार्टी ने आम आदमी को ही लूटा, वो भी टेस्ट के नाम पर. सो आज ये जो आपने रिपोर्ट अभी एक्सेस करके डाली है, दिस इज द कंप्लीट कंफर्मेशन of what were the allegations that were floating around, and today Kejriwal must answer. But unfortunately, when you ask him about Sheesh Mahal, he arrests your journalists. When you will ask him about Mohalla clinic, he might go and abuse or get somebody beaten up in your media team. So I think that Mr. Kejriwal, stop the drama, dharna and all this bahanebazi and come and answer the question. From Dawa to Daru, everything loota.
Thank you very much, Shehzad, for that point of view. That's the BJP reacting, saying that from Dawa to the, even when it comes to Daru, everything has been looted by the AAP Sarkar. But those are the allegations that we are leveled. We are talking about the interim report, the preliminary inquiry rather, that has now been taken up by the ACB. We talk about 2 such private diagnostic labs that these tests or these fake tests that were conducted, and right from the period of Aglis Diagnostic Limited from February 2023 to November 2023, over 12,457 tests that were done on blank mobile number 0. That was the number, mobile number 0. Let's talk about the Metropolis Healthcare from February 2023 to December 2023. Over 6,000 tests that were done on patients with fake mobile numbers. And you can see, have you ever seen such kind of a mobile number that just runs into 99999 and 999s and how many nines? So that has been another allegations that have been leveled even when it comes to the Mohalla clinics of having ghost patients and even phantom tests. So such kind of patients that never existed. Mobile numbers that started from 1, 2, 3, 4, 5. Over 2,467 tests that were done on mobile numbers numbers and repeated 80 plus times as well. There was a certain mismatch between the registered patients and the tested mobile numbers as well. And tests that were carried out in over 18.71 lakh amount, that has been around 20 crores. And even when it comes to the loss to the public exchequer that may have been incurred, this is the exclusive copy that Times Now has accessed of the ACB report, the preliminary inquiry report that is being conducted. But Bhavtosh, if I can come to you on another question as far as these two private diagnostic labs are concerned, have they also been approached by the ACB in a way to give them a notice to actually be a part of the investigation over certain anomalies in diagnostics tests that have been conducted in these Mohalla clinics, Bhavtosh?
Yes, Amita. In fact, remember, this is a PE or a preliminary inquiry. It is not registration of an FIR. So they were, in fact, one of the doctors was called in and she was examined. She, in fact, said that yes, she, in fact, made the investigators explain how this procedure is carried out. She said that Agilus as well as Metropolis had a system, or they had developed a software in which numbers were registered. Any patient who used to come, the numbers used to be registered, and once numbers used to be registered, then the test and treatment used to be carried out. Now, she was the one who, in fact, tipped ACB about how this was carried out. Then the data, the dump data was taken by the ACB, and then each individual who was, in fact, had done the test or had taken the treatment, they were, in fact, called. Now, that's the problem before the ACB, was that they physically called up or they telephonically called up all the numbers. And that's what we are looking here. Now, if you just if they had called up, if at all, if they call up all the numbers, then you can just imagine the kind of at least scam we are talking about here. If 65,000 numbers have turned out to be fake, then it could be possible that between February and December 2020, this scheme has been in operation for a number of years. Then we are looking at a possibility of hundreds of crores of scam which have taken place. And ACB has said that they will carry out their investigation once an FIR is registered. So far, Agilus and Metropolis are the two hospitals which are under scanner. More doctors could also be under scanner, because as Sabia has also said that there has been also an issue of fake attendance. It could be also possible that the doctors have not even attended the hospital. Fake tests have already been carried out. This has been already been proven. The treatments have turned out to be fake. So there are several issues, several layers to this scam. And ACB has said that they have just initiated.
Well, this is explosive. This is just a preliminary report that the ACB has been looking into these allegations, because this is the flagship healthcare initiative of the Aam Aadmi Party Sarkar, which they say that they are proud of. The Mohalla clinics, however, seems to be now facing serious allegations of financial irregularities.